Hello! As many of you know, I'm about 7.5 months post-op from my ACDF surgery. And in this episode, I am going to talk about something that nobody else is talking about. And that's all of the strange women's health issues that I have had since my ACDF surgery. So join me, Amy Giaquinto, Mama Fix It, as I dive into these issues and try and Mama Fix It my way out of them. The first thing I want to talk about is the fact that every time I have had surgery, it has triggered a period. Yes, it has. I don't know if it's the stress or, hormone disruption from medications, but whatever it is, I always get that period. I'm wondering how many of you women out there also experience the same thing. Drop me a comment below and let me know if this is something that you've had happen to you. Having a period immediately post-op when you are in a neck brace and are having trouble moving is not something that's fun, but it's something maybe you should plan for if you're planning to go into this ACDF surgery and kind of come up with some solutions. We have one of the toilet sprayers, we have one bidet seat, and then we actually have the spray hose. And I'm telling you, that made a world of difference. I don't think I could have survived having a period with the neck collar, not being able to rotate, twist, or do too much bending without that. So that is my advice to you. I have to say that the really nice thing about this whole surgery thing was that I got my period and that was it. I haven't had another one since. I'm serious. I'm like about 8 months out with no period. Now I know I was in a perimenopausal stage before my surgery. However, I think that what might have happened is the surgery may have triggered menopause. I'm not officially in menopause yet because menopause is, the official definition is going 12 or more months without a period. Well, I am in a state of amenorrhea right now. Maybe it's a perimenopausal thing, maybe it's going to be menopause, I don't know. But with that has come the convenience of not having to have period supplies on hand. Woohoo! Yay! At the same time, I'm still not convinced that my period isn't going to come back and revisit at some point, and we'll see what happens. The downside to all of that is that I am having lots of perimenopausal symptoms. I'm having hot flashes, like literally feel like I'm spontaneously combusting from time to time. I'm having cold flashes, which means that I feel like I have jumped into an icy river and turned into a popsicle. And I cannot warm up no matter what I do. So I'm having these issues. The other thing I want to talk about is weight gain. As I said in the last video, I have put on 15 pounds. Now, some of that I understand has to do with lack of really strenuous physical activity. Some of it is some emotional eating. Some of it is the fact that if I am indeed in perimenopause and hitting that menopause transition, my body is going to be telling me I need to eat more, and I've also lost muscle. So what happens when you eat more and you lose muscle? Well, muscle burns lots of calories during the day. So by losing that muscle, and also from the surgery, losing all the muscle that I've lost from that, from being inactive and whatnot, or less active than normal, I'm gonna put on weight. And so I have. And so I think the weight that I have gained has been exacerbated by the perimenopausal symptoms, because a lot of the weight, normally when I gain weight, it's usually in the legs and the arms and face and stuff. This time, it's that menopausal weight in the belly. So I think that's another struggle that I'm gonna have. It'll be interesting to see if it's more difficult to lose weight this time than it has been in the past. But I will keep you posted on that. Again, I'm gonna do a weight loss series coming up. We're gonna pull this weight off. We are, promise you, and we're gonna do it in a healthy way. One of the other things that nobody's talking about is I've had a lot of other joint pain with all of this. My fingers are swelling up, my elbows are hurting, my ankles are hurting, and it's not little hurts either. It's really bad. And sometimes I even get like trigger fingers when I wake up in the morning with my hands. And I think, based on my research and talking to other women who've gone through menopause, some of this may also be because of the hormone imbalances that are caused when you're going through menopause. The drops in estrogen and the drops in progesterone. So again, as I make my way through this maze, and as I get my nutrient levels up, because having low vitamin D can also cause some inflammation, I will let you know if those things start improving. But I think that the weird head to toe kind of pain and inflammation or traveling pains is another thing that nobody's talking about when you're of a certain age and you are a woman and you go through surgery. In the meantime, my sleep still sucks, absolutely sucks. So my doctor prescribed a sleeping medication called Trazodone. Trazodone is actually an antidepressant, but it's supposed to help with sleep. So I tried it out. I took a half a tablet the first night because medications like this affect me in really crazy ways. And I did. I never have a hard time getting to sleep. I just can't stay asleep because I'm waking up in pain and tossing and turning all night trying to find a comfortable position for my body to be in. That's been forever. So because of the undifferentiated connective tissue disease, but it's been made worse with ACDF because stuff is just crabby right now. So I took it and I didn't notice a whole lot of difference. Maybe I slept a little bit deeper when I was actually asleep, but I still tossed and turned and came in and out. So I took a whole pill the next night and same thing happened. Don't feel like it really helped a whole lot. Maybe I didn't wake up as much in the middle of the night. I didn't come as out of the sleep cycle. I was able to get back into it easier. I don't know. But I didn't think it was amazing. So I kept trying it. But then my mood did something awful. And I started experiencing kind of major depressive episode type stuff. So I decided, well, that's not worth it. Not gonna take the Trazodone anymore. Need to talk to my doctor about that one. So just be aware, I am also on duloxetine for nerve pain issues for undifferentiated connective tissue disease, and I'm also on hydroxychloroquine. Who knows, maybe there was some kind of interaction. I don't know, I'm real sensitive to medications. So at this point, I'm just gonna try and get my nutrient levels up so I can improve my sleep, because low iron really can have a huge impact on how you sleep. And not only is my iron low, but my ferritin is low as well. That can cause restless leg symptoms and cramping and all sorts of discomfort and aches and pains, as can lower vitamin D. And B12, of course, affects everything in your brain, so that can affect sleep too. I've talked to my doctor about it, and because I also am having nutrient deficiencies of iron and B12 and vitamin D, and my LDL cholesterol is a little elevated, all of these things, are part of this big picture that make me wonder, maybe is that why I'm not having a period right now? And if my nutrient levels get back up, especially my iron, will I have a period after that? I don't know. So anyway, let me go back to this. I would talk to my doctor and she suggested maybe thinking about hormone therapy, but neither one of us wanted to do the hormone therapy or start that at this point because my nutrient deficiencies are where they're at. So we want to take things one step at a time. Fix the nutrient deficiencies, get the exercise more regular, because I wasn't able to do as much as I wanted because of, I was feeling better with the ACDF, but then my ankle got all messed up. So I was kind of down for another 2 months or so. Actually, I'm working on about 6 weeks on that. Back to those hot and cold flashes. My doctor prescribed a medication called Veozah, and she submitted to the insurance company with the caveat that most insurance companies are going to want you to do hormone replacement therapy first before they'll cover Veozah. So I am 2 weeks out, and I just got a notice from my insurance company that they will not cover the Veozah for the hot flashes and the cold flashes. Now I could appeal this decision, but I'm not going to because I don't have the bandwidth right now. And the thing is now that I'm able to exercise a little bit more and my ankle is feeling better, I am able to control the hot flashes a bit more via really, really great exercise, especially muscle building exercises like with weights. And I'm controlling it by not drinking caffeine and not eating chocolate. And those things seem to be big triggers. Sugar is another really big trigger as well. So I just want to say if you're experiencing any of this, or if you think that surgery, any kind of surgery, has caused you to go into menopause, drop me a line, let me know. I'm super, super curious about that. I had a friend who said that her surgery must have triggered her to go into menopause at 37 years old. So, like I said, I believe it's possible. It's just not something that anybody's ever talking about, which I think we need to be talking about, because this is a major event in women's lives that affects our health throughout. And it can affect our bone growth, especially when we're trying to recover from ACDF surgery and we have a ton of bone to grow. So be sure to, at least if you're going through something like this, talk to your doctor, get those labs run, make sure you don't have any nutrient deficiencies like I did, and hopefully that will help enormously with some of your perimenopausal symptoms or menopausal symptoms post-surgery. The other issue that's a really big deal when you have ACDF surgery is that you can't get a mammogram, because with a mammogram, you have to turn your head all the way to the side, both directions. So you cannot get your mammogram until you can do that. The only other alternative is to go and get a breast ultrasound. But you have to file an appeal with your insurance company to get one, and you will probably have to pay for it as well out of pocket, because they allow for that preventative screening for mammograms, but they don't allow for preventative ultrasounds. An ultrasound is considered diagnostic screening. So if you have a risk of breast cancer and you need a mammogram, but you've had ACDF surgery, that is something that you're really, really, really gonna wanna figure out how to get that screening done so that you can stay safe, especially, like I said, if you have a history of breast cancer or if you felt a lump during your recovery from ACDF surgery. The other thing I want to talk about that nobody else is talking about is how women's anatomy and our clothing affects the way we heal from ACDF surgery. I had never gone into a physician's office or into a physical therapy office and had them mention anything about the type of bra I was wearing, even when I went in with thoracic outlet syndrome, which is basically when you get pinched nerves and pinched blood vessels in the thoracic outlet region, which is here, and then your arm goes numb or you get shooting pains going down your arm, okay? Like literally I can go here and turn my head and lose my pulse up here. That's how bad it gets. And nobody's ever mentioned this. So why are we not thinking about the weight and the pressure our bras are putting on this whole region through here? I mean, especially those of us with large breasts, okay? I said it, I mentioned the elephant in the room. I have large breasts, okay? I always have, I always will. There's nothing I can do about it. I mean, these things have been with me since I was a teenager, okay? Love them, hate them, whatever. This is me. And these are a problem because they pull my body forward. I am not paid at all by SheFit, but SheFit bras are the only ones that keep me from jiggling and wiggling, and they take a lot of pressure off of this region for me. If I wear a normal bra, like I will do for therapy appointments, physical therapy, when you're in a place that, you're not like getting naked for a massage, I'll wear a regular over-the-shoulder bra, but man, I can't be in those for very long. I need a bra that's supportive. It's not gonna pull me forward, not gonna round my shoulders forward, not gonna do this with my neck. Like, I have to wonder, with some of my neck stuff caused by just this enormous weight right here pulling me forward during the day. And is some of my upper back stuff, is some of my lower back stuff caused by the same thing? Like, these are the things we need to be thinking about. And I would love to hear what you have to say about that. I would also love it if somebody could come up with a fabulous, fabulous, fabulous bra that is beautiful, can fit inside of, shirts, was any other color than beige or white, or maybe black if you're lucky, that could fit someone who's not big around and has big boobs, okay? So that's my challenge to those of you who are in fashion and in design, is to come up with something like that, and come up with something like that that takes the pressure off of these areas and off of your trapezius muscles. I always joke that I'm gonna have grooves in my bones from my bras when I die. They're gonna do an autopsy and be like, dang, those are some grooves. They're bra grooves, right? But anything to get the pressure off of here. And you know, some people have the opportunity to free boob it and go without a bra. Those of us with larger breasts just don't. And that can create a lot of problems. So I just want you to think about that and maybe start opening a conversation with your physical therapist and your physicians about how to maintain all of these muscles, especially in your upper back and neck and shoulders and triceps, everything, so that you don't have to have future surgeries. You don't have to have all of this pain running down your arm or numbness and tingling that happens. Those are the biggest women's health issues that you're gonna face after any kind of major surgery, especially ACDF surgery. If you like my videos, please click that like button, please subscribe, please comment, and tell me all about your experiences. And you know, if you've had anything similar happen to you after surgery, I really appreciate it. Thank you so much. I'm Amy Giaquinto. I'm Mama Fix It. You can check out my website, www.amygiaquinto.com. Until next time, bye.